welcome to the Skeptics Guide to the Universe. No, the Skeptics Track at DragonCon. I know I'm going to get...
That's next.
Yeah.
That's next.
That's right. We wanted to make sure everybody remembered that the Skeptics Guide to the Universe is actually going to be at 7 o'clock in the Crystal Ballroom. So make sure y'all don't miss that. So I'm Angie Mattke. I'm here with Steve Novella. Oh, we don't have our signs, but... sort of as a... follow up on this morning's talk on giving sort of the background on evidence and standards of evidence and such. We're going to kind of hop around in the slides, but it's going to be more of a what's the craziest kind of thing you've seen?
Yeah, what's the crazy
like
stuff we have to deal with?
Yeah, pretty much.
As skeptics and as doctors, because not just as skeptics. We have patients who come to us every day with interesting questions, interesting perspectives on things.
Yes, indeed, indeed. Like Robitussin cures everything.
Mm-hmm.
And if you have if there are any questions, there's a mic out here. If you just shout things from the front row or from the middle rows or whatever, we can't hear you. And also, you're on video, so please go to the microphone. We're happy to have folks in. So, Steve, what have you seen?
So I see it all pretty much. I mean, almost on a daily basis, I have patients ask me questions about non-science-based treatments. Acupuncture is probably the most common these days, and often they'll say that another doctor or a physical therapist or somebody recommended it to them. Mm-hmm. But I get asked about often there's they come to you with a philosophy sometimes, not just like about specific treatments. They say like, you have any natural treatment for this? That's always a good question. Very, very common. Now, I don't want to take any of those drugs. Is there any natural treatment for this? And they don't really even know what they mean by that either, right?
True.
My favorite one though, I had a patient who thought that nutrition can cure everything, wanted to be GMO free and all that. Tried to eat clean, and then of course you take a full history and you take a smoking history, and she smokes, and clearly answering that question on the heels of like I'm only clean eating, I don't put any toxins in my body. Do you smoke? Oh yeah.
Oh sure, absolutely.
But I only smoke organic cigarettes. So you're covered at that point.
Absolutely.
Yeah, but it shows you. So this is very, very common. You have somebody who is trying to be healthy, which is good. We certainly encourage people to try to live a healthful lifestyle, but it's just being misdirected. She's not doing probably the single most important thing for her health, like quit smoking. Like that's demonstrably unhealthy. There's no question about that. And yet she's spending a lot of time and effort and her mental energy focusing on things that are of no consequence whatsoever. And that, the only way to really deal with that is education. But that's hard to do on a person-by-person basis in the office.
It's true.
We do our best, but it's like I can't undo all the marketing and propaganda in one visit.
That's so true, and there's not often time either because you have other patients waiting, and you can't you can't spend all your time doing that. The thing that I see that same kind of thing, but we have I don't have as many vaccine deniers in some areas of the country as I've had in some areas of the country as others. I'm an emergency physician and I practice in several states. I'm a traveling emergency physician, and there are certainly pockets where I see a lot more anti-vaccine information, and the other things about like Robitussin and certain things seem to have magic cures. Like there's a ginger ale that people swear cures everything up in Pennsylvania, and or Doc Brown's or something. I can't remember what it's called, but I had this, and it took a long time before I could figure out what they were talking about. So
yeah, and then when you take, you have to ask patients now, like you say, what medications are you taking over the counter? What medications are prescribed to you? And you have to ask, what supplements do you take? What herbs? What other things? If you don't, they will often not tell you.
True.
Actually, I find that patients are offering that information, volunteering that information more frequently. It was like 10 years ago, it was maybe 20%. It's increasing over time because I think they just consider, oh, this is all more mainstream. So the good news is they tell us more about it, but you still have to ask because there's no guarantee. And most of my patients are on one or more things that are completely worthless. Like turmeric. Mm-hmm. I'm taking turmeric.
Right.
And it's just standard. I take a multivitamin, unnecessary. I take turmeric, worthless, and then whatever, my prescription medications, and then maybe some supplements that are necessary. It's just all mixed in there. It's just now to them, it's just all part of the background.
They also will give you a brand name, or they'll say, I take something for prostate, or they'll take something for whatever ailment, and they don't know what's in it. And I'll sometimes have to Google it to find out, and sometimes it turns out there's like caffeine in it, there's lots of other stuff, and I have to break the news to them that the things that they think are in them are not really in them.
Yeah.
And they find that very disturbing sometimes.
Right. So I usually tell patients to bring it in. Mm-hmm. So you're an ER physician, so might not have the follow-up. I'll just say, just bring in the bottles for everything that you're taking. And you're right, there was some, like I had a patient who literally had a heart attack.
I've had some of those too.
Yeah. But they had a heart attack out of the blue. Like this wasn't a cardiac patient or anything. And they were taking some medication, which, was concerning. But I had to go through, I had to do a full med review on them. And they were undisclosing to any of their physicians they were taking diet pills that were loaded. Massive dose. And it wasn't caffeine. It was a caffeine derivative that nobody would recognize what that chemical name was. I had to look it up. I'm like, yeah, shit. I kind of knew, because you get familiar with the technical chemical names of things like that. Looks like a stimulant to me. And I looked it up like, yep, there you go. That's a stimulant. It's a caffeine metabolite. They had the kind of heart attack that is provoked by stimulants. It was Prinzmetal, right? It was, So the arteries were clamping down. It wasn't a blood clot. It was just the arteries were spastic because they were overstimulated. Almost died. They coded in the ER. If they were been a little bit slower in getting to the ER, they would have died.
And those are the ones that the cardiologists call us crazy when we call us a code STEMI, a code heart attack on, because they go in and they do a catheterization and there's no disease in the artery. Well, this was but look, the EKG, and it's just that kind of spasm of the artery. So the stimulants and the herbal things I've seen liver failure from people drinking herbal teas, and instead of taking their medicines, or in addition to taking their medicines, and unintentionally affecting their medication absorption.
The scariest one I had was a patient who had Creutzfeldt-Jakob disease, which is the human version of mad cow disease, and it's a horrible disease. They were dead within a week of me diagnosing them. But they were getting treated by a naturopath who was mismanaging them for months, diagnosing them with, it's electromagnetic, sensitivity, so stop all exposure to electronic devices. And then they just progressively went through, it's a dairy allergy, whatever. So this guy was systematically removing from his diet anything that the naturopath thought might be causing their CJD, which he completely missed the diagnosis on. So he was by the time I saw him, he was emaciated. I'm certain it precipitated, his death. But one of the supplements that he was taking was a thyroid supplement that was purified from bovine, cow thyroid. There's no way to prove that that's where he got the CJD because he's been taking it for a long time. I did send it to the CDC to make whatever they could of it, but that's the kind of stuff that we see, and it was amazing. That guy filled this table with supplements that he was taking. It's just scary.
It really is. And Group B strep from placenta, that nursing mothers, if they're getting their placenta dried and whatever, and then taking it, they can keep colonizing their infant who does not have a mature immune system at that point and cannot fight off an infection of that caliber, and the infants will die or suffer severe disability.
Yeah. And speaking of contaminants, so another thing that is not uncommon, it's not that big a deal in Connecticut. I do see it occasionally. There's the raw milk thing, right? Where people think that, you have to eat the raw milk because when you purify it, when you pasteurize it, you kill the milk. It's like, no, you really don't. You just kill the bacteria that's contaminating the milk. So you occasionally will see infections that result from that. But I did have a patient who had an encephalitis, so they had a viral infection in the brain. And it turns out that they were getting their vegetables, their fresh produce from a farmer's market, which again, no problem with that per se, but that is a setup for certain kinds of viral infections. There's one, this is going to gross you out, so if we don't,
Bring it
I'll give you the trigger alert. There's one type. There are some infections. This I think is a bacteria that occurs because rats pee on the produce at nighttime, right? That is the chain of infection. And so if the produce isn't stored properly at all times, that can happen, right? And that's one of the ones that can cause an encephalitis. Mm-hmm. So you have to be careful about that. So we have the safest food in human history. Our agricultural system, the system of distributing, storing, inspecting food is the safest food that humanity has ever had by orders of magnitude. Things still slip through the cracks, right? And we hear about it because there's a system to catch it and say we're recalling all the romaine lettuce. Great, that happens because there's a system in place, mm-hmm. right? But people bypass that because they think they're getting healthier food, but they really aren't. You're just bypassing all of the safety measures that have been put in place systematically over decades to minimize spoilage and minimize contamination and infection. Foodborne illness is still a major killer, mm-hmm. and all we could really do is minimize it. But yeah, if you go, I'm going to go to the raw, only, the localvore thing, that's all pseudoscience. That's all nonsense. Mm-hmm. But and again, this is not to impugn farmers who know what they're doing and who follow regulations, et cetera. But what I find is that the more into woo they are, the less likely they are to be following strict, guidelines in terms of hygiene. Because if you don't believe in science, those are not the people you want in charge of your food. Mm-hmm. That's the bottom line.
That's true. And just acupuncture, you can get some local system, even with just regular acupuncture, they're not cleaning the skin. You're mm-hmm. getting introduction of normal skin bacteria into areas where they shouldn't be. I've seen a patient with a pneumothorax.
Yeah, that happens. That means they basically went a little bit too far. They poked a hole through the lung, and then the air is leaking out. Every time they breathe, the air comes outside the lung, and it slowly collapses the lung so you can't breathe. Mm-hmm. If it happens on one side, it's really uncomfortable. If it happens on both sides, you die, right? Yes. Unless you get attention. Unless you get medical attention.
Right.
But of course, if they're sticking needles all over the place, it could certainly happen bilaterally. Mm-hmm. Yep. That's so there's a certain, I can't put what the percentage is, but that's one of the major complications of acupuncture is pneumothorax. Yeah.
Right, and when you introduce the needle into the skin, and you've introduced that skin flora, that's how IV drug abusers end up with endocarditis and infection of the mm-hmm. lining of the heart, mm-hmm. Which can be deadly as well.
Yep, there was a recent case of pericardial bleed, hematoma, mm-hmm. from acupuncture, and the patient died. Mm-hmm. Went a little bit too far, poked a hole in the lining around the heart, bleeding around the heart, so the heart is no longer able to pump blood, and that's usually fatal.
Yep.
Yeah.
Yep. So, excuse me, cupping is similar to acupuncture in the sense that it does the local tissue damage. Mm-hmm. A little bit less of a risk of dropping a lung. It depends, I guess, mm-hmm. on how hard you're cupping. But if y'all have seen pictures from the Olympics a few years back, hang on, I got a picture.
The thing I like about cupping and the Olympics is everyone who's doing it, right? Because it leaves a mark behind.
Yeah.
It was kind of like the kinesio tape, which we'll talk about too. Like kinesio tape was also an Olympic fad a few mm-hmm. years before the cupping Olympic fad. Right. And again, it's on the outside, so yes. you can see the athletes who are going for it. But there pseudoscience. I should have done a trigger
warning on that one.
Yeah, is the whole panel has a trigger warning.
Yes, indeed.
Just get used to it. So cupping is a good example, like acupuncture, of an older treatment that was pure pseudoscience and then has survived into modern times, but had to be sort of repackaged mm-hmm. for a modern audience, right? So originally, cupping was bloodletting. The point of the vacuum that you put the cup against the skin, you burn something on the outside of it, it heats up the air, causes a partial vacuum, and that sucks up the skin, causes a hickey, right? That's basically what it does. The point of that was to then release the blood, right? That's the wet cupping. You slice open the the blood blister that you form when you do bloodletting. That's still the way cupping is practiced in some parts of the world, like Iran, right? That's cupping with the wet cupping. That's what the term means. Is popular in Iran, in some parts of the Middle East, in Japan, and under certain traditions. But then dry cupping is just doing the same thing without the bloodletting. So what's the point of it? Well, they had to just invent a new excuse for it, right? Well, we're not doing bloodletting, so we're sucking out the toxins. What toxins? I don't know. There's toxins everywhere. So how do you know you're sucking out the toxins? Because look, there's a red mark left behind. So that's it. There's just a completely made up new excuse for what it's doing. Or my favorite one is it's creating more oxygen circulation to the tissue. No, it isn't. It's just making the blood go out of where it's supposed to be into the tissue. The body's really good at delivering oxygen to the tissues. I mean, that's if you're healthy, your tissue is getting all the oxygen it needs. I mean, there's multiple powerful physiological, biochemical mechanisms to optimize. When a cell's not getting enough oxygen, it releases triggers that say, send blood my way, I need more oxygen. If you're not getting enough oxygen to the tissues, you have a disease. There's something going on that is preventing that from happening. So, once you have pretty much 100% oxygen delivery to the tissues, which is what happens in a healthy person, you can't go beyond that, right? You can't get extra oxygen. It doesn't do any good. But I especially love that because the same people who are going to promote increasing oxygen delivery will then take antioxidants.
Yep.
Because you can't have too much oxygen, well, then maybe the body has just enough. Let it regulate itself, right. And if things break, we'll fix it. But otherwise, if it let it regulate itself, you're not going to make the body regulate itself better by making hickeys or taking a supplement.
So are you saying that that's not the reason that teenagers are more healthy? Yeah. Because they all have the hickeys on them.
I think the cause and effect is maybe going the other direction there.
Okay, so you mentioned the kinesio tape, and this is the dude. Where is it? He's the guy. That's the one. He's the chiropractor that invented it, and so this is what we were seeing in the Olympics. That's the guy, and it's useful if you use it as an actual athletic tape. Yeah. But just putting it on the skin really does not do anything. This is my daughter. So she came home from basketball practice one day, and she was all taped up. The coach was clearly a true believer in the kinesio tape.
It can't hurt, right? You always say that. And so I like to say kinesio tape, otherwise known as tape. Yeah. That's what it is, But and then athletes, of course, they're so susceptible to suggestion and to just the psychological aspect because they're performing at the absolute outer limit of human capability. Even slight psychological things, insecurity versus anything that is encouraging can sure have a little bit of an effect. But is there an actual physical effect from putting that tape on? Well, it's a brace. Physical therapists will brace something that is injured or swollen or whatever. But beyond that, there's nothing special or magical about it. And like the patterns that they were putting it into was like witchcraft. There's no anatomical basis for that.
That's right.
Yeah, but it was invented by a chiropractor, which is always a red flag.
Indeed.
Yeah. But it's because there is chiropractor is such a diverse profession. There's as Sam Homola, who's a science-based chiropractor who writes for us occasionally at Science-Based Medicine, said there's an awful lot that happens under the umbrella of chiropractic. That's actually one of the questions I sort of dread when a patient says, should I go to a chiropractor? Or they're going to a chiropractor, or what do you think about chiropractic? It's like, okay, do you want the short answer or the not-so-short answer? I can't give you the long answer.
Yeah, you're not going to like either one of them.
You're not going to like either one, but the thing is, the short answer is it depends. I don't know what chiropractors do because any individual chiropractor could do so many different things. If they're just doing essentially physical therapy, for acute, uncomplicated lower back strain, sure, that will relax your muscles temporarily. You'll feel good for a day. They're not realigning your spine. They're not doing anything like that. Don't let them do anything violent. Don't let them touch your neck. But if your back feels better after a chiropractic and they're not selling you any nonsense, then fine, that's reasonably benign. Unfortunately, unfortunately, that's not all that they do. It's most of what they do, actually, but that's not all that they do. And then the pseudoscience they get into is all over the board. It's all over the board. They do homeopathy, they do acupuncture, they do nutrition nonsense, they do kinesiotape, they do applied kinesiology. I don't know if you have a slide on that, but we could talk about that. And then my favorite, right, is neurological chiropractic. Oh. Anybody here hear of that? Mm-hmm. So I read a paper by a chiropractic neurologist once that was...
I'm sorry, I gotta stop you there.
Yeah, I should, right? And, in case you don't know, I'm a neurologist, so I'm pretty reasonably up to date on the whole neurology thing. And this paper was incomprehensible to me, and it read like poetry. It was beautiful in its own way. It was like all poetry.
Like Jabberwocky?
Like Jabberwocky, but with like techno-babble. But it was like really good techno-babble, And like this, but it was utter nonsense, complete from beginning to end. But you could see like this guy, somebody would read this and go, this guy is either a super genius or a complete moron.
He had to realign the EPS conduits.
Right, whatever. Yeah, I mean, it was just like it was full on turbo encabulator. Thanks. But that's their practicing neurology. So let me give you another example. There's one chiropractic neurologist who treats traumatic brain injury, right? And he famously treated, I'm forgetting his name, Evan probably knows his name, he treated a famous hockey player who had a brain injury, a traumatic brain injury. Do you know what I'm talking about?
Sidney Crosby was the hockey player.
Yeah, I think
Sidney Crosby?
Yeah, Sidney Crosby. I think that's the guy.
Was the hockey player?
Yeah. So he was treating him for his post-traumatic brain injury symptoms, right? Which is a common thing that we see and we treat. And he had invented this chair that could rotate in 3 dimensions in every direction. And he would do this, elaborate treatment and to repair his brain. And then you read the explanation of what's happening about this complete technobabble description about how he's reprogramming the brain and blah, blah, all this nonsense. And what he was doing, he just reinvented vestibular therapy, which is something that we already do and works. It helps people. It basically uses the brain plasticity to retrain the brain it's like the brain's recalibrating itself so that it could integrate its sensory modalities better so that the patient doesn't feel vertigo. They don't feel like patients will tell you after a traumatic brain injury, like if they're driving in the car and the trees are going by them on the road, that makes them super dizzy. Like their brain can't handle rapidly changing visual stimuli, right? They can't sync it up with all their other stimuli and it's amazing that we're not dizzy all the time. Like what the brain is doing to keep us feeling okay is amazing, but when you throw it off even a little bit, that's like one of the canaries in the coal mine of traumatic brain injury. You throw the brain off kilter even a little bit and people are dizzy. They just can't process that information in real time as robustly as they need to. And this helps them over months of doing, you basically put them through exercises like you do this 100 times and then you get up and down and then the brain will slowly learn how to process that information again. And that's basically what he was doing, but in a $100,000 chair, right? But he thought he reinvented neuro rehab, and it was just all nonsense. But it's really impressive. And then you have a famous hockey player, who's like, "This guy saved my life and saved my career. That's it. We're done." Like, there's no amount of explanation I'm going to be able to do to go against that kind of endorsement.
Yeah.
Frustrating.
It is frustrating.
Yeah.
So frustrating. So you mentioned the applied kinesiology.
Yes. Right.
So you want to talk about that a moment?
Yeah. So applied kinesiology. Richard, do you want to come up here and do a demonstration of applied kinesiology?
I think that's an outstanding idea. Come on,
up here.
Richard.
So Richard Saunders knows all. He's debunked this very commonly on YouTube videos. You can see this, but so essentially, applied kinesiology is using physical strength for diagnosis and treatment. So one of the things they do is they say to see if you're allergic to something, they'll put the thing to be tested in your hand, and if you're allergic to that substance, you'll become weak. Right, you won't be able to hold up your arm. It's really
I'm skeptical.
It's really magic, But Richard's going to demonstrate how easy it is to produce this effect.
So we're going to see if this delicious Australian mustard,
You want to just take the...
that's good,
give
has
that
an
to him.
effect on you, sir.
Wanna come in?
Are you ready?
Ready.
All right. What I want you to do, we're going to test your balance. See how it affects your balance. First of all, stand like that with your feet together. That's right. Arm out straight, like this. Lift this leg. That's it. I'm going to give you a must stick. Put the must stick in your other hand. Are you ready?
Ready.
Ready? Resist. 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 Come on, stand up straight. Terrible. Let's take the must stick away. Are you ready, sir?
Ready.
Resist as hard as you can. Resist. Resist. That's incredible. That's
Isn't that
incredible.
amazing?
See, he's obviously allergic to mustics. You're not
Right.
coming to Australia, right?
That I believe.
Yeah. Thank you
Thanks.
very much. Our lovely assistants, thank you very much.
So it's literally a parlor trick. I mean, it's literally a parlor trick. And all you have to do is just change the angle of your attack a little bit, and your
And throw a little
your
theatrics
leverage,
in.
your little leverage, and you can make somebody feel strong or weak. And so you could do anything with that. Once you have that basic technique, that's how the power band. You guys remember the power bands that would make athletes more athletic? That's what they did. We were at a skeptical conference, and in the hall, it was SciCon 2 years ago, I think. In the hallway, there was somebody selling the equivalent of power bands, and we're like, "You have no idea what conference you're at right now, do you?" And so we just chatted them up just to see what they would say, and they gave us the whole spiel, about the energy frequencies and all that nonsense, and did the demonstration. So yeah, I could do the demonstration too. I did it on TV, like Richard did, I used my car keys as the power bands, and I did it to the reporter. It's so easy. It's like one of those things that works every time, and it's so easy. It's like the easiest magic trick in the world. But there's a whole branch of fake medicine based upon this parlor trick. It's amazing.
Yep.
But they will claim all sorts of things. Then they'll treat allergies. They'll treat all sorts of things based upon that. The other one I like is when you sort of just, I'll demonstrate it very quickly. You stand up and then you rotate.
Oh, the twisting one?
Yeah, the twist up. It's like, see how far can you point behind you, right? Then they do the thing, right? Then now see how far you can go. And like, oh, I can go further, And again, it works every time. It's so easy. It's just one of those things that you could always get people to go an extra, foot or so on the second go-round. So whatever you did to them works, always. But that's applied kinesiology, and it's also now just the typical parlor tricks that are used to sell anything, essential oils or power bands or the herb thing or the foot massage thing. What do you call it?
Oh, the one with the-
reflexology.
yeah.
Reflexology.
Yeah. So I had a patient who had seen one of those demonstrations and had enthusiastically purchased his $80 power band.
Yeah.
And but developed an allergic reaction to the band itself. And so I know I felt really bad for the poor man. He was pretty high up in a company or something, and he was obviously not accustomed to being fooled. But like we have heard already today by Jamie and others, the con men are out to get you, and the more you think you can't be fooled, the easier it is. And so I asked him how he was sold on this, and he described the demonstration, which I then reproduced on his wife with my stethoscope. And he tore it off and threw it away. So, I mean, one at a time. Sometimes we have to do it one at a time.
Yeah, sometimes.
Yep. So, do we have any questions? We've got a microphone out there and a room load of people. I can't imagine there aren't some out there. No?
They'll
Here
queue
comes
up.
somebody, yeah. Okay, I mean, we can continue to vamp, I guess. Oh, there's somebody.
My question is, there's a lot of natural things, and there's obviously like a huge spectrum of what that encompasses. And some studies have been done and that kind of thing. So is there a place for scientifically based, more natural medicine? And then conversely, are there things that we're doing in modern medicine that is like more mainstream medicine that maybe isn't the best idea?
Well, Botox is natural.
Yeah.
I would like to remind you.
Botulinum toxin is all natural, and it's the most powerful toxin, picogram for picogram, on the planet. So the problem with the question is, are there natural things that work, and are there mainstream medicines that are not such a good idea? And the answer is, of course, to both those. But the problem is that the term natural is not really defined in any official or operational way, to the point that it's really a meaningless concept. It's really just a marketing term. What does it mean to be natural? What does that even mean? You can't really define it. You could try to parse it. Well, maybe it means that it occurs in nature. Okay, why does that matter? That kind of implies that nature cares about us. Nature doesn't give a rat's ass about the human species. You know, the 99.99, and I forget how many 9% of the pesticides that you will consume in your life were naturally created by the plant foods that you eat. Plants make poisons to kill things so that they don't eat them. Right? We've at the end of 500 million years of multicellular evolutionary warfare, where everything is trying to kill everything else. So most of the things out there in nature are not our friend. We've had to engineer pretty much all of our food so that it's palatable to us. Almost with very few, like 3 or 4 things, literally like a single-digit thing of plants. Every other plant has been modified beyond recognition from its state in nature, just so that we can eat it. And what did we do? We bred out all of those pesticides. That's what we did. That's why crops are actually fairly fragile, because we took away all their protection so that we can eat them, in large amounts without getting sick.
Except tobacco, which we smoke on purpose.
Right, but which is a toxin.
It's not a bug, it's a feature, right?
Which is a toxin, right.
Yeah.
And on the other hand, so mainstream medicine does a lot of toxic things, a lot of invasive, risky interventions, and they're not all the things that are done under the guise of mainstream medicine are necessarily good. But the difference there is that it all comes down to risk versus benefit, right? Everything has risk. Everything has risk. Everything you do and everything you don't do has risk. But the goal of scientific medicine is to use the best evidence possible to know what the risk versus the benefit of any decision that we make is, any intervention that we do is. So does every practitioner practice optimal risk versus benefit medicine? No, of course not. That's because it's hard. Not everybody is perfectly trained. Some people have just different ideas about what's the best thing to do. And there's a lot of bias in the system as well. We're humans, and humans are flawed, and we practice flawed medicine. Mm-hmm. Absolutely. But at least the system is designed to be self-critical and to try to work these things out, and there is a standard that's based upon a process. That's the best we could do. And that's really what we advocate for. We want one standard based upon a rational scientific process, and not to create the sort of marketing terms that really are meant to confuse people. When you're told that something is natural, you're really being invited not to think too carefully about the important stuff, but just to be reassured by a fake health halo around a marketing term that's been around for hundreds of years. That's the other thing that I'd like audiences to understand. All the stuff that we're talking about today has been around for hundreds of years in terms of the scams and the cons. All the idea, like the parlor tricks, these parlor tricks were done 200 years ago. Fake magnetic devices were debunked 200 years ago. Using natural as a marketing term is hundreds of years old. These things are not new. And when you do research into the history of snake oil, I was amazed. I was amazed to learn that, oh my God, some doctor wrote an entire book about fake magnetic devices 200 years ago. It was all there. It's just that we're just doing this again and again every generation. It's the same scams we're debunking over and over again, and people think it's new. But this has been going on forever, as long as there's been medicine.
My question is the medical community doing any type of outreach to reach the general populace? Beyond this, because it seems to be very targeted to a specific audience. I would say most of everyone here is pretty skeptical already.
Right.
But it feels like science has greatly outpaced the general public understanding. So a lot of research is being done. There's a lot of research papers, but not everyone can read those papers, and they're behind paywalls.
Yeah.
And it's kind of scary to think that there's a lot of knowledge out there that we can't access.
Yeah. Well, besides the one at a time thing, which is kind of what some of we've talked about has been, we have resources now like science-based medicine, what'stheharm.net, Skeptoid, some of the other wonderful skeptical information. And it's, I think, slowly but surely becoming easier to communicate. Those are certainly the 3 websites that I give to my patients when they have comments about going to a chiropractor or whatever. I personally have seen someone paralyzed by a chiropractor, so I really try very hard to avoid recommending. But if you're going to, here's this article on this website that is not for profit, and it is working very hard to give you the good information that you can then make. Oh, quackwatch.com, that's another good one. And then I give them that information, and that helps. But again, it's one at a time. But then I tell them, talk to your friends. And fortunately, we do have resources, and they are starting to get out into the mainstream. You made a comment about some legislators that had taken text directly from your.
Absolutely. So we're making inroads, and I think. But if you look at, so there's I think what the skeptics are doing is we're doing everything we can, right, to fill in this gap. But the gap is there, and that gap is in academia. And what that means is that academics don't value public communication as much as they should, in my opinion. So there is a move in that direction. Like if you apply to an NIH grant, right? So NIH is the National Institutes of Health. You're basically asking the government to fund your research. You have to include a statement of how are the results of your research going to be communicated to the public. So that's starting to be incorporated into the whole process of funding research. This is for the public good. So how are you going to make this good for the public, right? How are you going to make sure they have access to the fruits of this research that we're funding? And I do think that universities are starting to come around to the point where they need to incorporate more science communication, but it's still kind of haphazard and sort of patchwork, and not as nearly as systematic and as valued as it really needs to be. So because it really isn't, I think, keeping up with the avalanche of misinformation that's out there. So we're working as hard as we can, but we're not doing nearly enough. And we kind of know what we need to do, but we don't really have buy-in yet, I think, from the academia and scientific community.
Well, not just that, though. I mean, I practice in a community setting, and whatever it took academia 10 years to do, it takes 25 years for it to percolate out into the community, because those doctors are often resistant to change, or they are not up on the most recent literature, or it takes some sort of external motivating force for them to start to adhere to more scientific standards. But they often will end up practicing in their own little bubble and develop a trend. I'm seeing a disturbing trend of physicians who I formerly respected, but have taken these acupuncture courses and are adding them to their repertoire of, and I don't doubt their good intentions, but they just haven't been able to examine it with the sort of critical thinking, because that's not what this whole setup is for. It's to get you to invest into the whole practice, and so you're not really offering your patients a good thing. So, yes, sir. I'm sorry?
Quackwatch.
Quackwatch.com.
Hello. My question is, what can you tell us about intermittent fasting? Is it good? Can it be good? Or is it all bad? Or
So it depends, is the short answer. Again, it depends on who you are. I just recently had a patient who was doing intermittent fasting, and they have migraines, and on their fasting days they were provoking migraines. I'm like, well, that's not going to work for you, because fasting triggers your migraines. And we can't give individual medical advice, right? We could just say generally, what does the literature show? There was just a study, I think 2 or 3 days ago, just this week, where they said that I haven't really had a chance to do a deep dive on that individual study.
Really? Why on earth not?
What?
Why on earth not?
Well, I'm just, what have we been doing the last 3 days? But that's kind of a moving target right now in terms of the evidence. I'm not aware of any evidence that there's any advantage to doing it. The research showed that it could be a useful strategy. So I think what that really means is some people are able to control their caloric intake by doing intermittent fasting, but the thing that's making them lose weight is reducing their caloric intake. So not the intermittent fasting itself. So I think it's one strategy that may work, but it's not necessarily better than any other strategy at reducing caloric intake, and it does come with additional risks, Like, for example, if you have diabetes, you have to regulate your blood sugar. You have to be on a very consistent caloric schedule. If you have things that get triggered by fluctuations in your blood sugar, like migraines, then that may not be a good idea for you, et cetera, et cetera. So that's the kind of decision that I would make with your physician who knows your medical history. And if your goal is to lose weight, you want to. My advice is, and I think the literature. If you take a broader look at the literature, it's like what works long term. So that's the other thing. What works under what conditions? If you're saying what works long term, meaning you get to a healthful weight and you stay there for a long period of time, the things that work are the strategies are the most sustainable. So you should always ask yourself, can I do this for the rest of my life? If you're doing it just for now to lose weight, that is a failed strategy, because whenever you stop doing whatever it is you're doing to lose weight, you will gain the weight back. That's like 95+%. Very few people actually keep the weight off that they lose. And the ones that do are ones that permanently changed their lifestyle. Not the ones who went on a diet or did a weight loss strategy or did anything temporary. So that context is important. There may be no specific advantage to it, and it may not be a sustainable strategy, but if you do it, it could work by lowering your calories.
Very good.
Sure.
Thank you.
Well, thanks.
Hi. Hello?
Hi.
I was curious about these parlor tricks that you were talking about, or any strategies that companies or salesmen might be using to maybe persuade us in a certain direction. I was wondering if you could talk any more about that, and specifically the one with the band you've been mentioning. You kind of said it was so simple. I was wondering if you could show us that.
Yeah, so the power band, so they say like it improves your strength, improves your balance, right? And so they'll do tests, and then they'll put the power band on you, and then they'll do the same thing again, and your performance is better. So Richard demonstrated one of them. That's the most common, because the way that you push down on the arm can dramatically affect the amount of force that you're producing without the person really being aware. Because visually, it may look very similar.
Yeah. He's got good videos on those online.
Yeah, there's good videos on YouTube for that. And then the other one was the range of motion. I just demonstrated one, but there's other ones as well where it's all effort dependent. So anything where you're asking the person to do anything that's effort dependent, there's a huge placebo effect there, because you just encourage them a little bit more. And this is something like I have to teach my students when I'm doing the neurological exam. There are certain parts of the exam that are effort dependent, and whenever that's the case, you have to encourage the person to make a maximal effort. Otherwise, your results are meaningless, right? They only mean something if that was at the patient's maximal effort. But so we know firsthand how effort dependent asking the patient to do anything is. And there's just a lot of variations on those themes, a lot of range of motion kind of things that you could do. Also, I don't know if you've experienced this, but there was a guy who had a company with just 1,000 fraudulent devices, right? That was the company. And he was demonstrating them all to me. So the other thing they did was, they had this blanket. Remember this, having the blanket with the infrared fibers woven into them. Yep. What's an infrared fiber? It didn't make any sense. So you wrap that around your neck, and then it'll take the sour out of lemon juice. Oh, well, that sounds like a good objective test, right? No subjective perception there whatsoever. But that's the kind of thing that they do. Anything that there's a subjective component to it, or they can literally fool you with some kind of easy technique. But those were the most common ones that we encounter. Yeah.
Hello.
Hi.
Hello.
So probably most people in this room, as well as I, has probably been burned by both the natural industry as well as the kind of pharmaceutical industry. So when you're talking to your doctor, and you mentioned that there's a trend among doctors to not stay updated, are there any red flags that if we see something, so say we go to a specialist or we get referred somewhere, are there any sort of red flags that come up if we see this, we go, oh, maybe I need to look into finding a different specialist and not go to this doctor. So maybe 2 to 3 red flags that we could look for?
I'm pretty suspicious when folks are selling supplements out of their
Yeah.
office.
Yeah, so selling anything out of their office is definitely a huge red flag.
Yeah.
Anything, we call that self-referral, which is actively discouraged and in some contexts is illegal. But so if they're selling something, or if they refer you to pseudoscientific practitioners, or a lot of people ask me, oh, my doctor recommended homeopathy. What should I do? Go to a different doctor.
Go to a different doctor.
There are some deal killers out there. That's why if that guy thinks homeopathy, which by the way is 100% pure, not snake oil, it's magic potion. Like it's not even a snake oil. That's magic. Like that guy clearly has no idea what homeopathy is, or he believes in magic. Either way. He just recommended something to you that he has no idea what it is, or he recommended something to you that he knows what it is. Either way, that's bad. So anything like that, I think that's over a line. I would say that's probably not something. I would tell them why you're leaving, because they need to hear it. Sometimes they do it because they think patients want them to be open, to that sort of thing. But if you say, listen, that's like pseudoscience, I don't feel comfortable with that, and maybe this isn't going to work out, they need to hear that. They need to know why you're not showing up for your follow-up appointment. Other more subtle things, if doctors are practicing outside their scope of practice or their area of expertise, for a physician. So if they are an MD and they're an internist and they say, oh yeah, I can treat your, whatever, something that's highly specialized that's not internal medicine, then you could ask them, are you board certified in that? And that's a perfectly fair question. What is your board certification in? If are you going to be my cardiologist now, or shouldn't you refer me to a cardiologist? So that's also a red flag if they want to do everything themselves and they don't seem interested in referring out for things. And then look at the pamphlets in their audience, in their office. Look at the pamphlets. If they're all pretty, from respectable, like the American Heart Association and the CDC, right, from things that seem like they are authoritative sources, and they're all saying things that are mainstream and don't then set off any red flags, then you're probably okay. But if there are pamphlets in there for woo devices or questionable things, that also would be another red flag.
If the plants are dead.
If the plants are dead, yeah. If the magazines are too old,
CBD oil is being touted as a treatment or cure for almost everything, from hiccups to cancer. I'm wondering, between CBD and THC and the combinations of these two, some research is finally starting to be done, but not a lot yet. This is shrinking. Do we know what?
Yeah, don't touch it. Don't touch it, because Mark will.
Yeah, don't touch it.
Drive it.
Do we know what research has already been done, what we know now, and what is being done with regard to THC, CBD, and cancer?
Yeah.
Okay.
So very little is the short answer. So I'm keeping very up to date on the neurological research for CBD and other cannabinoids, and to some extent on everything else. But then David Gorski, who's our oncologist at Science-Based Medicine, is keeping up to date on all the oncology research. Here's the quick answer for this complicated area, but we are at the beginning of a multi-decade arc of research that will be done into these things. And we don't know what they're good for or what they're not good for at this point in time. It's preliminary. This is the kind of thing you wouldn't even be hearing about yet. You wouldn't be hearing about this for 10 years or 20 years until we got to the more definitive clinical trial stage. And the only reason you are hearing about it is because of the social aspect of this, that it's cannabinoids, and because you can get access to it without needing a prescription.
And so, Ohio and Texas just accidentally legalized.
Yeah. So it is the new snake oil now, it's the new magic potion that's good for everything. Will it turn into a useful pharmaceutical for certain things? Probably. There are receptors, there are cannabinoid receptors, and so there's a actual mechanism there that I'm sure that we will learn how to exploit. There's encouraging preliminary research for things like appetite and nausea. Like we kind of already knew about that. For pain, it's really complicated. Pain, it's more that it may just distract you or just take away the anxiety produced by the pain, just mellows you out, but it doesn't necessarily treat the pain. For neuropathic pain, which is what I'm interested in, very discouraging preliminary research so far, which tells me a lot about what the mechanism may be there, that it's probably mostly emotional and psychological and not so much physical in terms of pain, et cetera. But it's too early to say. So again, I get asked that almost daily now by my patients, and the answer is it's early days in the research. We can't really say anything about it from any definitive clinical research point of view. When you get to the more the less plausible, claims like cancer, no, I'm not holding out any. I will be surprised if anything that currently exists. They would have to develop something from it. But even then, there's no reason to suspect that there's anything in there that's going to be a useful agent against cancer. So that would come out of the blue. Why did that come up? It's just completely being made up because it's just the new snake oil. That's it. So pain, maybe, anxiety, sure, but things like that. Cancer, no. The plausibility is extremely low. And we'll know in 10 or 20 years. Realistically, we'll know in 10 or 20 years.
Yeah, I was just going to show, I have that. You see how it, snake oil, it cures headache, neuralgia, toothache, earache, backache, swelling, sprains, sore chest, swelling of the throat, contracted cords and muscles, stiff joints, wrenches, dislocations, cuts, bruises, soreness of inflammation from corns, bunions, insect, and reptile bites.
Reptile bites, that's useful.
Isn't that fun? Yeah.
So if a snake bites you, you can treat that with snake oil.
Apparently, it's homeopathic.
It's homeopathic.
Yeah.
So that's the good for what ails you red flag, right?
Yeah.
If it works for everything, it probably works for nothing. That's just if you're not basing your claims on actual scientific evidence, then if you're basing it on anecdote, you will think it works for everything. Or if you don't care, then you might as well claim it works for everything to expand your customer base. So that is a huge red flag when it's like, why would that one thing cure all these different things?
Mm-hmm. As a neurologist and a skeptic by nature, I wanted to get your quick take on neurofeedback technology. Mm-hmm. It feels like fad medicine, but I wanted to get your take. Is it entirely, placebo, or are there some benefits with limits?
Yeah, so that's a good question. What about neurofeedback? And I get the same question about meditation and similar things like that. So there are relaxation techniques, and neurofeedback means like you have an EEG or you have some kind of physiological feedback that you're using to help calm you down, slow your heart rate, calm your mind, etc. So the question is it better than just relaxing, right? Are there benefits to it? Sure. Are there benefits to relaxing? Absolutely. Is neurofeedback better than relaxing? That's where I don't know what the answer to that question is. And because the research never seems to really get to that point. And it's the same thing with meditation, but worse. Meditation, there's two problems with it. There's that problem. So you're not controlling for the specific intervention. You're not controlling for the non-specific effects. And therefore, you can't claim that this specific intervention is better than the non-specific benefits. So to give you an example of that concept, there's a proliferation of calling everything therapy, right? We have music therapy and this kind of therapy. So, okay, that's fine. Using music as a tool for rehab is perfectly legitimate. But when you throw the word therapy after something, it kind of implies there's a specific benefit to the specific thing that you're doing. It could just be a way of getting the patient to do something that they need to do. So like, for example, like sports therapy, it's like, okay, that's exercise, right? That's
sounds
fine.
more sciencey.
Right, but it's fine to use sports to get people to exercise, but does that make it sports therapy or just a mechanism of exercise? So my question is neurofeedback just a way to get people to relax, right? And the literature never separates those out properly, and to do that, you would need to have a proper control, like they're equal amount of relaxation, but with a different mechanism. And you never really get that. With meditation, you have the added problem that they don't define it. They just don't define what it is. And there was a recent, 6 months ago or so, systematic review of meditation, and the authors concluded, we don't know what it is. It's not defined in the literature, and so you can't really even make statements about does it work. Yeah, one study shows it lowers blood pressure, but it's just relaxation at that point. And if it's just relaxation, then fine, it's relaxation. It does what relaxation does. Is there something extra? Nobody can define what that extra thing is. And so do that first, define what it is, and then maybe we can design research studies to say if that extra thing has any specific effect. So this is a lot of alternative medicine. In my opinion, a lot of alternative medicine is repackaging non-specific effects from common things that we already know are good for you, like a good diet or exercise or relaxation, but with a magical specific ritual around it. Right, and that's what gets all the attention and everything, and then they give this technobabble explanation for spiritual or whatever explanation for why that works. But at the end of the day, it's just the non-specific common thing that we already know about. So that's kind of what I feel about neurofeedback. But I'm willing to be convinced. But you got to do the kind of research that will show me there's a specific thing there. Does that fit with what you think? Yeah.
Yeah, I like Harriet Hall's comment about naturopathy. It's like the things that they do that are good are not special, and the things that they do that are special are not good.
Right.
Yeah. Yes.
Hi. So I feel like I've been seeing functional medicine on the rise recently, but I've seen it both in naturopathic medicine and also standard medicine. So I just want to know what your thoughts are, especially with relation to like GI panels, since those seem to be the big ones with gut flora and other, hormones and stuff.
So we have a lot of good articles about functional medicine on science-based medicine. So if you want to do a really detailed evaluation, that just plug functional medicine into science-based medicine, you'll get there. But let me give you the quickie answer, is that it's all nonsense, right, is the quick answer. So, and what they're doing, so functional medicine is this idea that they're going to like figure out what like your specific biochemistry or whatever is your physiology, and then they're gonna cater to your specific needs. So they do all of these testing, and so pseudoscientific medical testing is a whole thing unto itself. There are entire labs dedicated to this, and so in order for a medical test to be useful, it has to be validated. And what does that mean? It means it's measuring something real. That real thing that it's measuring correlates to something meaningful in that some health outcome that is real, and it has internal and external validity. Like you get the same result when you do it multiple times. What they're doing is a whole bunch. It's the technobabble of laboratory testing. They're doing a whole bunch of tests of something that nobody knows what it means. Right? They're just measuring stuff that they could measure, and then they're just making up what it means in a way that it sounds good. And then they'll say, therefore, you need these supplements or whatever. You have thyroid fatigue. They just make up all this nonsense that doesn't really exist. That's functional medicine. It's not really mainstream. There are MDs doing it. They're not mainstream. There are MDs who are doing it as a shtick of personalized medicine, but it's not. Again, like what you said, there's nothing that they're doing that's unique to functional medicine is helpful or real, and anything they're doing that's helpful is not unique to functional medicine. I don't know what it is beyond the fact that they're doing a whole bunch of unnecessary, dubious laboratory testing. And I have yet to see anything in there that's useful or meaningful.
Thank you. So we got time for a couple more questions.
Hi, ma'am. So this will be mostly directed to you as an ER physician. So I'm a BLS provider for a level 2 trauma hospital. And I'm getting pulled in two different directions by physicians telling me who to board and collar with the spinal motion restriction. And I can't really tell if it's old hat versus new hat or what. Do you have anything to say regarding spinal motion restriction?
Well, ATLS protocols have been shifting over time. I mean, initially you boarded and collared everybody, no matter what the complaint. They stub their toe. Everybody's boarded and collared. Right. But there also are movements saying, well, if they're not having neck pain and they're awake and alert and can tell you, maybe they don't need to be boarded and collared. It's just sort of going to be situation dependent. And I'm going to have to defer to your online medical providers about what specific recommendations they're going to have in your jurisdiction.
Naturally.
So, sorry.
No, it's okay.
That's what I tell my family when they ask me specific medical advice as well. Yeah, no, go see your doctor.
Yeah, but I think the thing is, we don't know everything, and sometimes there's different ways to interpret the evidence. Like recently, 2 different organizations came out with different recommendations about when women should get breast mammograms.
Right.
And so who do you believe?
Right. Well, and when there's sort of an adage that if there's a dozen ways to do something, there's no one great way to do it.
Yeah.
So we're working on it.
It means they both have validity.
Yes.
And you might want to find out why people would think one way or the other. And with the mammograms, it was how you balance the risk versus benefit and what you consider a risk. So one group was considering the anxiety caused by a false positive a risk, and the other group was saying that's paternalistic and we don't want to consider that that as a risk. And so that's why they have different recommendations of what age. But that's, you have to understand that that's the discussion that's happening to really know why they might disagree.
I mean, we're lurching as quickly and as well as we can towards truth, but sometimes we have some.
But the other thing is, I would say, when there's that kind of nuanced disagreement among reasonable professionals, the stakes are probably low, right? They're probably both reasonable, even if there might be nuanced differences.
Yeah. Hi.
One more.
Hi, Dr. Novella, you said something very early on, very casually, and I was hoping you could speak to it because it really threw me for a loop. I think you said multivitamins, you don't need those.
Yes. Again, I have multiple articles on this. So if you are a healthy person, there is no evidence that there is any health benefit to taking a multivitamin. In fact, if you look at the largest observational studies that we have and the experimental studies, meaning that people were sort of randomized to whether they were taking a multivitamin or not, people who are taking vitamins do a little bit worse than people who aren't taking multivitamins. And there's controversy over how to interpret that, because there's multiple different ways to interpret that. It's possible that it's just a correlation but the multivitamins aren't making people less healthy. It's just that less healthy people are taking multivitamins. That's one possible interpretation. But in the research data, so it's not that where that is factored out. It could be that people are overdoing certain vitamins, especially antioxidants, which we know are not good for your heart health in high doses. So there's a few things we could say for sure about after massive amount of research, there's no evidence for any benefit for routine supplementation. So I say routine, meaning in everybody who's otherwise healthy. We also know that it's absolutely no substitute for eating a healthful, well-rounded diet. And there may be the false sense of security effect where people who take a multivitamin don't worry so much about their diet. But we know that it's not a replacement for a good diet. So you're better off just having a good diet than trying to use a multivitamin as a fallback.
So let's just say I didn't get good vitamins from my diet. Let's say I had a crappy diet.
Then improve your diet.
Indeed. It's safe. It's better that way.
Doesn't help.
So a multivitamin does not fix a bad diet. And people think it does, and it doesn't. And that may be why we're seeing this negative effect from it.
Yeah, and the only supplement that I would even consider recommending routinely would be folate.
Well, so there's from that, but that's routinely in pregnant women, or women who are at risk of becoming pregnant, of childbearing age. So that's targeted supplementation. So there's tons of, I prescribe vitamins every day. I measure levels. I do evidence-based supplementation for specific things, but routine without a targeted population or a specific indication for that individual patient, there's no evidence of any benefit.
Right. Well, that's all we have time for. Thank you so much, everyone, for coming. Thank you, Steve, for enjoying. Y'all don't forget the Skeptics Guide to the Universe at 7 o'clock down in the Crystal Ballroom. Thank you very much.